Hello everyone, it is Victor here with my 2-month post-top surgery update. Alright, my goal is to make this one short and sweet, so we're gonna do a speed round. So at week 5 post-op, I ended up with a hole in my left side on the incision. It turns out that that was really my body just forcing out the stitches at that spot, but it did end up being kind of bloody. It did bleed a lot, and it was like clearly an open wound, and so my doctor told me to just like cover it, and then after covering it for a week it had resolved itself and it's like all closed up now and all nice and doesn't hurt or anything. At week 6 I had my last post-op appointment, and so at that appointment they just looked at me and said, hey, you look all good, good results, good to go. And they also cut out the stitches. So the stitches were supposed to dissolve by themselves, but different people's bodies react differently with the stitches, and so the stitches just didn't dissolve for me. And so they ended up taking scissors and just kind of snipping all around. And then I just kind of like rubbed off the stitches at the edges of the nipples. And then the stitches that were on the incisions had actually resolved themselves. And so I didn't need to worry about anything there. Starting at that 6-week mark, I was officially no longer compressing using the compression vest or compression tank tops. And I was also no longer covering my nipples with like gauze and tape and bacitracin and all that. At that 6-week doctor appointment, my doctor cleared me for all physical activity, although I did kind of try to ease into it slowly, mostly because my muscles were very not conditioned and were very out of shape after having not used them for nearly 2 months. So I have started very slowly easing back into exercise. Since that 6-week mark, I've started sleeping on my side again, which is so amazing. Like, who would have thought that side sleeping actually feels so good? I thought I was gonna have a difficult time sleeping on my back, but I was just really tired after the surgery, and so it wasn't a problem to just sleep. And then I guess I just kind of got used to it, and so it wasn't a big deal, but it feels so good and relaxing to sleep on my side again, just because that's how I usually sleep when I'm not, you know, recovering from surgery, and so that's really nice to feel like a normal person again. I also started scar care in addition to the silicone gel that I was putting on my chest. I also started using Sika tape, which is just that tape that kind of tapes on and then it kind of flexes with you as you move, and so far that's been going really well. Finally, I have started to do arm weight exercises at this point, so I am easing into all of the muscle groups by doing like inclined push-ups, not even full push-ups because I'm weak at this point. And I've been trying to do some like very lightweight, like over the shoulder, over the head shoulder press type things, just to get some of my muscles back in working order. So I've been incorporating those into my other like weight bearing exercises to try and get myself, you know, up and running again. I've also been running since my 6-week doctor's appointment, and so that's been totally fine. And I have played tennis a couple of times. So that's a new thing for me and really fun, but also I can definitely, like, when I go to like hit the ball reaching with my racket, I can feel things stretching, and I can't tell if it's like my muscles just getting used to being able to, you know, flex and move again, or if it's like skin stretching, but so far I haven't had any abnormal bruising or bleeding or anything like that, and so I think we're good. So tennis so far has been okay with, like, you know, moving, running around, waving my arms around, that kind of stuff. Lastly, I want to provide a brief update on the aesthetics of my chest. So when I first saw my chest 2 months ago, to me it looked very asymmetrical, where the scars were at different heights and the nipples were vastly different sizes and shapes. But since then, I feel like it's sort of started to even out a little bit, where my scars don't seem as lopsided anymore, and my nipples definitely have kind of grown into similar sizes and shapes, so they don't look like really, really different when I look at them in the mirror. Now, I don't really know if that's because I'm starting to get used to how my chest looks and it looks normal to me now, or if because things have actually settled down and started to change. So, not really sure about that one, but I did take pics early on and continue to take pictures now, so hopefully I'll be able to compare and at least know whether things actually changed or whether it's just my perception. My scars are still very, very red, and I realized recently that, you know, I have Asian skin, and Asian skin tends to scar like a little bit more severely than white skin in terms of pigmentation and also in terms of like hypertrophic scarring or keloid type things. So I'm just trying to keep an eye on that, and maybe at some point I'll show y'all. Maybe I'll just like wait till it heals as much as I think it's going to heal and then show people. Not really sure yet. That's all I've got for this update. Until next time.